Hello and welcome to another episode of Reporter Direct with me, Revathi Krishnan. I'm a senior correspondent at ThePrint and I've been here for over 2.5 years. Today, I will be discussing about my reporting assignment in Odisha. My colleague Manisha and I have spent about over 10 days here in Odisha. And we're basically I'm going to be explaining what our reporting assignment is all about. However, before I get started, I want to thank you, the subscriber, for subscribing to ThePrint.in for across our channels. And I hope, thank you for subscribing and believing in good journalism. It keeps us on our toes because we feel we have a responsibility to deliver, and to deliver the truth and stories to unheard of. And something new per se. So coming to our reporting assignment, we landed here on 1st of December and we got down to doing, let's say, really in-depth stories across a wide range of subjects and topics within Odisha. The main reason for this reporting assignment is that Odisha is actually developing and it's a part of India which many people don't know about. There's a lot which is happening there, but unfortunately, the reportage in the mainstream media is not that much. And what we came to do here is change that specifically. So to start off with one thing which everyone or many people across India are very, very attached to is the Jagannath temple in Puri. We went there right in the middle or in the beginning, of our reporting trip, where the Puri per se is a tourist attraction. It has beautiful beaches, which are actually very, very unknown. When you think beaches, you never think of Odisha or Puri, but there's some beautiful beaches, for example, the Blue Flag Beach. And the main redevelopment which is happening in the city of Puri is the temple redevelopment of the Parikrama. So basically, which is the outer periphery, what the state government is doing under the ASHA scheme. So why I mentioned Puri per se is because this ASHA scheme is basically a scheme which is looking to make Puri a World Heritage Site. There's going to be a development of an airport. There's cleanup of beaches. They're really promoting tourism. And more so the Jagannath temple. Now, the Jagannath temple for Odiyas holds huge significance and per se for Hindus across the world as well. It is one of the 4 Char Dhams, a very auspicious place where according to the religion or legend, people will attain moksha or salvation. So what is happening, which is also very interesting, because Puri, anything to do with religion or temples in India is a sensitive subject and people hold very dearly to themselves. So what is happening for the first time at a cost of nearly 800 crores is the development of a Parikrama complex where a 75-meter periphery, so they've acquired 75 meters of land in terms of width across its 2-kilometer circumference to redevelop. So they're making a circumference where someone can do a parikrama. There will be a new clock tower. There'll be restrooms. There's beautification drives, basically this green corridor as well. And there'll be an information cum kiosk desk. So this is mainly being done per se to attract more tourists, to manage tourists better. The collector, Mrs. Samir Verma, also told us that, because there was no holding and there was no place per se, but prior to the pandemic, there have been many risks of a stampede. I think it's important to note that to give you an example of how many tourists come to the temple and what a tourist attraction Puri is solely because of the Jagannath temple. Let's say pre-pandemic on a weekday, there'd be 60 to 70,000 tourists, and on a weekend, it would hit almost 1 lakh. Now this is pre-pandemic. Not even post-pandemic. In the middle of a pandemic, they're seeing about 30 to 40,000 people just on the weekdays, and on the weekends it's 60,000. So what is this redevelopment? What is happening? How does it affect people per se, and what does it aim to do is what one of our stories is focused on. It has also come out, so do read that and please give us your feedback. Now, taking this forward, what we're also doing is, now Puri is not the only place where temple redevelopment is taking place, and this is a story which will be upcoming, and we're going to be working on it very, very closely. There's redevelopment taking across multiple districts in Odisha. It's also important to know that Odisha is a big state with many districts. So there's temple redevelopment taking place in Mayurbhanj, in Sambalpur, in Ganjam, in Bhubaneswar itself, the Lingaraj temple, at a cost of roughly about 700 crores. Now, our story is going to be focused on why is this redevelopment taking place now? In the middle of a pandemic, there we spoke to experts regarding our first story as well as this story. In the middle of a pandemic, you think that there would be investment in especially with a new mutant, a new mutation, which is Omicron. You think there'd be investment in hospitals, in let's say COVID management. Someone's talking about better healthcare, or even schools for that matter. But why is this redevelopment of temples per se taking place? I just want to put a rider that we're not saying that this is at the cost of the other things I mentioned earlier, but this is one line of questioning which is happening. So our larger story is going to be about the larger, let's say, bird's eye view of the temple redevelopment taking place in these multiple districts, because it's also important to note that before the Panchayat elections of 2017, Congress was the main opposition to the main Biju Janata Dal, which is headed by current Chief Minister Naveen Patnaik. Post the Panchayat elections of 2017, where the BJP defeated the Congress, it emerged as a main opposition party. In 2019 as well, it provided a main counter to the BJD in the Lok Sabha elections. In fact, Bhubaneswar is one of the places where there is a BJP MP. So just to give you a slight hint, not a hint, but slight spoilers, if I may say, for our for the story on the temple redevelopment, is also a political line of questioning, or a political string of thought is happening as questioning whether this is a way of countering the rise of the BJP in Odisha, or if it's just to look at, let's say, development per se. So I'd urge you to keep out for that. Now, politics and politics aside, there is also, we have questions regarding this as well. We're doing a very interesting story. We've seen that. So Odisha, unlike many other states, has its own health scheme. It has not adopted Ayushman Bharat of the central government, and it has its own health scheme called the Biju Swasthya Kalyan Yojana, which started in 2018. So we're doing a larger story on it. Under the Biju Swasthya Kalyan Yojana, in fact, I have the note here right with me. Under this Yojana, people in government hospitals across, irrespective in all centers, irrespective of income status or residence, get free let's say they have free services starting from sub-centers, PHCs, CHCs, which is community health centers, area hospitals, district hospitals, in government hospitals. However, in private hospitals, if you have a BPL card or an AAY card, or an annual income of 60,000 in rural or 60,000 in urban areas, you're covered per se by for 5 lakhs per family, and 10 lakhs for male and 10 lakhs for women. Now, and mind you, under this BSKY, which is also what is known as COVID treatment, according to the authorities, was completely free. So if I was in ICU for about a month, it was completely free. So our story actually goes into the specifics of the BSKY scheme, when it started, how much its reach is, its comparisons to Ayushman Bharat actually, and how much is the penetration, in the rural areas. So for this, to understand this story and give at least our viewers, our subscribers, a larger understanding of this health scheme, my colleague Manisha and I traveled across Odisha. So we started in Puri. There's a village called Pipli. We looked at Bhubaneswar. We then went to Kandhamal, which is, it's about, let's say, a bit more than 250 kilometers from Bhubaneswar. From Kandhamal, we went to this place called the KBK corridor, which is the Kalahandi, Balangir, Koraput corridor. So we went to Kalahandi and Koraput. Then we drove up towards, let's say, West Odisha, where we covered Sundargarh, to understand how it's being implemented in these rural areas. The state, so while this was rolled out 3 years back, the BSKY also now has launched smart cards. So again, to give you a small update, this was, so many people did not know about this Yojana, but after the penetration of the smart cards, now it's like another source of identity for them. So we're also looking into that in our story. We're doing another story on, so we've spoken about I mentioned the KBK corridor here. It was earlier known for looking at agriculture, also farming, and Odisha is actually a very big paddy farming state. Kalahandi, where we visited, is known as the rice bowl of Odisha. But historically, this KBK corridor, which now has 8 districts under it, was known for famines, abject poverty, starvation deaths. However, now it is producing food in surplus. How has this happened? What are the policy changes at the ground level? What are the changes which the state government has brought in is what we look at. And we're also doing a very interesting story on one ASHA worker called Matilda Kullu, who was featured in the Forbes Power List, Forbes Women Power List of 2021. And this is the first time she's been done. So all about her story, her journey. I'm also going to start taking a few questions now. So just going to start taking a few questions. Okay, so we have a question from Lukshay Verma from Mumbai, who's asking basically the Biju Swasthya Kalyan Yojana. He's saying, how is the Odisha government's health coverage policy different from the PMJY, which is Ayushman Bharat, and what's making it work efficiently? So I didn't get into the story too much because I didn't want to reveal more, but because of this pointed question. So we asked actually Mission Director of Health of Odisha, asking him, why have you not implemented Ayushman Bharat? And he said one thing, that Ayushman Bharat only covers IPD services. Here we cover OPD services. Ayushman Bharat has a coverage of about 60% people in the state. We are touching nearly 90%. And there's also another thing which the mission director also explained to us, that, he said that this is more focused towards our own, this is more focused towards our own people, and we know what is, we know how to then understand the penetration. He said that, and under what they want to run is Biju Swasthya Kalyan Yojana. So it's not only for Odisha, it's for Odiyas. So they're trying to impanel private hospitals in other parts of the country, so beyond the states, so that Odiyas can avail this service. So there's obviously a far-reaching let's say, policy or scheme. So this is where it differs. This is where it differs in terms of its policy, at least in its inception. In its implementation, I would say that, you have to look at Ayushman Bharat from a larger perspective. So I think any policy scheme which is designed specifically for one particular state, within and targeting specifically its polity, may have a few advantages. But a central scheme is difficult to compare, but it's also a central scheme which is also, let's say, successful in many other places. So I would say what's making it so, in terms of where it's different, is its reach of the Biju Swasthya Kalyan Yojana and the services people can avail under it. It's and like it's completely free COVID treatment, as I mentioned earlier, under the Biju Swasthya Kalyan Yojana, and it's also specifically targeting ODIs per se, which I would say is what is making it work effectively. So please look into the agricultural development in Odisha. It's learned that Odisha state included nutri-cereals in PDS and midday meal. How is it helping its farmers in terms of pricing and consumers in terms of nutrition? So I'm really glad someone asked this question. And this question was actually asked, I'm sorry I didn't mention this earlier, by Dashrath Tambale from Pune. So Dashrath, actually, if you see this, our story on the KBK corridor, which will look at agriculture and farming, will also look at nutrition of people in this corridor. And it's quite interesting because a state government report on food security and nutrition by the Odisha government, which released in 2020, while it spoke of a food surplus in these areas and how, they were seeing a huge, a marked change in terms of production. In terms of nutrition, it's still lacking. And I think this is because of its historical, because it didn't have a head start, or because of, historically, it has been dragged down. So just to give you some pointers in terms of nutrition and how, let's say, dire it is, I'm just going to give you a few data points, but just to start off before I can open my data points, much of the population is anemic. There's malnutrition. The required dietary allowances as per the state or what the rate is, people aren't even matching up to 50% of the required dietary allowances. Many of the children are undernourished. So I am going to give you some data points so that you can at least understand this. So there is stunting and wasting, height to age, height to weight, and people are underweight. There's a high incidence of malnutrition, both in children and women. About so the adult malnutrition and anemia levels are also very high in this region, and there's low literacy as well, which also then corroborates, or not corroborates, it basically is connected to this malnourishment problem, which is also there. And okay, so now in terms of inadequate energy, so historically the KBK region bears a very high burden of undernourished population. So there's such is inadequacy in terms of energy, proteins, and fats that it is 56% less than the required dietary allowances in terms of energy, 46% less than the required dietary allowances in terms of protein, and 70% less in terms of the required dietary allowances in terms of fats. This is per capita per day. In the urban areas, and this is the rural, so in the urban areas, it's not like the situation is much better. 58% of the population consumed less than the required dietary allowances levels in terms of energy, 54% in terms of protein and fat on a per capita basis. There's such a high incidence in terms of malnourishment among children in the KBK region that 42.3% of under 5 children are stunted, 27.9% are wasted, and 44.7% are underweight. The incidence of anemia is up to 67.4%. Now, these are very, very staggering figures. But I was also speaking to my editor regarding this, and I was speaking to experts. They said when a place is anyway historically has had a very late start in terms of its development. Now, I mean, Kalahandi was the second largest rice procuring state. It will take some time to, let's say, come up to the levels. So let's say this change from famines or starvation deaths to food surplus not happened overnight. It's taken about 15 to 20 years. There's something called the Biju KBK Yojana. There's the Indravati Dam. There are many other schemes implemented by the state government specific to each region. So such as Kalahandi, Balangir, Koraput, Malkangiri. So these are different places within this corridor. So if the if there is food surplus, if there is food surplus or food production surplus, then, I mean, one hopes that with the correct policy changes over a bit more period, if you give it more period of time, that these numbers will also start will also start changing and will become better. But this is just an idea to explain to you. I mean, this is also what our story will be focused on. So I hope this answers your question. So someone, Mr. Murli Gopalan from Chennai is asking, what are the reasons for the continued faith of people of Odisha on the CM despite its long backwardness? So I don't know about this long, I won't answer the question about the long backwardness, but what I will answer the question about is what is the continued faith of people in CM of Odisha? Who is Naveen Patnaik? Now, Mr. Patnaik is heading the Biju Janata Dal, and prior to Mr. Patnaik, it was his father, Mr. Biju Patnaik, who headed, who was leading Odisha. Now, there is this huge faith in him, and this is visible in, the posters. We actually saw very few posters of the Prime Minister or any central leader. It was only Naveen Patnaik, and Naveen Patnaik, not only in the big cities, but in the smaller regions, the smaller districts, the, very small villages, interiors, they're only posters of Naveen Patnaik. You have to understand that it's in regional place, and I'll give a comparison or a parallel to this would be, let's say, for example, in Chennai, you have, or in Tamil Nadu, sorry, you have two competing parties, but these are regional parties, which is the AIDMK and the DMK. So for Odisha, the main party right now is the Biju Janata Dal. Sure, there is a BJP and the Congress as well, but the main, let's say, faith comes because you feel that you are protecting the people of Odisha. There's someone who they can identify with. It's a son of the soil theory as well. Mr. Biju Patnaik is such a household name in Odisha that most of the schemes under the BJD are all named. Biju is their most scheme. So there's Biju Swasthya Kalyan Yojana, there's Biju Expressway, there is the Biju KBK Yojana. So, and these I'm just mentioning just one odd. So there is, there's the name, there's the face. So that kind of faith comes very strongly. You also have to understand there is so much faith within the BJD because BJD also had partnered with the BJP earlier, So that's just give you one, just an insight into their politics, and now they no longer partner with them. So there is this undevoted faith. Many people say that, we will vote. They don't say we will vote for the BJD actually. They say we will vote for Naveen Patnaik. So such is the faith in Mr. Patnaik. What would be interesting to note would be, if the BJD has, the Biju Janata Dal has other figures, other recognizable figures, because it's also important to note that Mr. Naveen Patnaik is, he's no longer very young. He is elderly and he is also only going to grow older. So will there be any, let's say, successor? Will there be a bunch of leaders people can identify with? On the ground right now, from my experiences, there aren't too many. They only identify or they note Naveen Patnaik, and they say we will vote for him. When you say what about after him, they don't know. Some are questioning, questioning Modi as a choice. So I think this continued faith would be interesting to see, who next after Naveen Patnaik, because in other places now, so I drew a parallel between Tamil Nadu and Odisha in terms of regional parties and their undevoted faith. For the AIDMK, you have you have the former chief minister Edappadi Palaniswamy, but then you also have O Paneerselvam. You have many other leaders who are fairly strong and, let's say, have a connect with the public. In terms of the DMK, there's Stalin, who's the current chief minister. He has a son, Udaynidhi. He has a sister called Kanimori. So they have they're fairly popular. But even within, let's say, in the Trinamool Congress, you have Mamta Banerjee, you have her nephew Abhishek Banerjee. So there are other leaders and many more within the BJD. There's right now no one else who at least we've encountered who are seeing what next after Naveen Patnaik. So I hope that gives you some insight into the question. Mr. Lakiram Mahadevan from Chennai as well. My wife and I visited Puri in 2019 and we thoroughly enjoyed it. We were really impressed with the feedback they got. We'd be grateful to give some light on the impression. It's correct. Okay. So actually, I'm glad. So they're asking what is the secret. Mr. Lakshmiran is asking what is the secret of CM Patnaik's popularity despite years of incumbency. And this is quite interesting. As I just mentioned, there's such a huge there's such a huge presence. More than anything, I think the faith comes from a constant presence. Wherever, if you throughout the state, when you are traveling, there is a very understated presence of Naveen Patnaik through, let's say, his face. There's some scheme which is being announced, which his poster, whether it's on billboards, on street lamps. But in Puri per se, there is a concerted effort, as I mentioned, under this ABHA scheme. So to give you an example, I would also urge you to read our article on the redevelopment of Puri. But the ABHA scheme is called the Augmentation Basic Amenities and Development of Heritage and Architecture at Puri. This scheme, and I'm just saying this undivided, the secret of it would probably also stem from Puri. In Puri, and such is the significance of Puri and Lord Jagannath, where people were explaining to us that for any auspicious occasion, the first invite does not go to someone near, it goes to Lord Jagannath. And to give you a bit of insight into Naveen Patnaik, before any campaign rally of his, he starts from Puri. After any win,